BSI clean and safe. I have one patient. The mechanism of the injury is a motor vehicle collision. I'm going to call for ALS backup. I'm going to approach the patient. I'm going to take C-spinal mobilization. I'm going to pass off our professional partner. Okay, I'm going to assess the patient's mental status. Hey, sir, can you hear me?
Your patient's unresponsive.
I'm going to try pain. Does he respond to pain?
No.
Okay, my general impression of this patient is poor. This is unresponsive. Apparent life threats can be multi-system trauma, so I'm going to open his airway with a modified jaw thrust, look, listen, and feel for respirations. What's my respiration rate in quality?
Respiration rate is one.
Is 8-inch shallow. Okay, I'm gonna have a partner size and apply an OPA, take a BME on high flow 2 to 15 minutes a minute, and I'm gonna pass the airway and ventilations over to my professional partner. Does my partner have it?
Consider it done.
Cool. Okay, I'm gonna expose the chest. I'm gonna look, see if I have equal chest rise and fall, so I see if I have any wounds or deformity. What do I have?
You have a hole in the chest.
Here?
Above the
Okay.
left nipple.
I'm going to, is it a sucking chest wound?
No.
Is there bubbles coming out on exhalation?
Yes.
Okay, I'm going to apply an occlusive dressing and tape it down on 3 sides. Okay, any other wounds or deformities and a note on the chest?
No.
Okay, I'm going to feel for pulse, checking carotid and radial at the same time.
Your pulse is 140.
My pulse is present, good.
Oh.
Skin color, temp condition.
Colon clammy.
Okay, I'm going to do a gross body sweep for blood. Over the head, neck, the face for bleeding. The arm, expose. Fill all over the arm. Expose the pants, cut the pants if I need to. Expose. Feel for any bleeding. I see any bleeding here.
You have some arterial bleed behind the knee.
Is it bright red and it's burning? Or
Yes.
arterial bleeding? I'm going to apply direct pressure. Is bleeding control?
Bleeding is controlled.
Okay, we're going to manage that in place and continue on. Circle around the patient. Assess his other arm. Feeling any bleeding here.
You have some dark red bleeding on the elbow.
Okay, I'm going to note that. The patient with that talking about the C-spine. I see any bleeding here. I'm going to look on this leg. I'm going to cut this leg, this pants, expose the leg. I see any other bleeding?
No other bleeding.
All right. So I have a high priority patient is rapid transport, so I do a rapid trauma assessment. There's no other life threats that I may have missed. Any other life threats that I find?
No other life
I'm going to package the patient for transport. I'll take the back of the neck. We're going to size and apply appropriate size seat collar. Okay. We're going to long roll the patient. We get on the head mask count. I'm going to grab here. I'm going to have my partner grab here and here. And we're going to long roll on the count of 3 on my head mask count.
1, 2, 3.
We'll long roll together as a unit. We're going to expose the patient's back. Just see if I find any step down in the spine. See if I have any wounds back here, and the wounds in the buttocks, the posterior leg. Do I see anything?
No.
And then count down 3. We're going to log roll the patient up the spine board as a unit.
1, 2, 3.
Okay. Now the patient's position in the center of the spine board, which Karen Nichols then will be said last. We're going to load the patient up into the unit. On the way out to the unit, I'm going to ask any biases, anything about the patient, medical history, meds, allergies, or what happened.
No.
Nobody knows nothing.
Nobody knows
We
anything.
have to do the patient, okay? Once we're inside of the ambulance, we'll get our gear together here. We'll assess it, get his baseline set of vital signs. The patient's blood pressure.
Is 80/64.
80/64, okay. Pulse rate, what's his pulse rate?
123.
123, and respiration will be controlled by a professional partner with a bag of mask. Patient showing signs of shock and electrical shock, we're covering him with a blanket, guardian laying supine, spine board, and guardian high flow O2. En route, now I'm going to do my detailed head and toe assessment. I'm going to look in the head for any wounds, deformity, decap BTLS. I'm gonna check behind the ears for battle signs. I'm gonna check around the eyes for any periorbital ecchymosis. I'm gonna check the pupils, see if they're pearl, if they're equals and reactive to light. Check the nose, see if it's stable. I'm gonna recess the airway between ventilations, make sure it's clear. I don't have anything in the airway. Clear, okay, cool. I'm gonna palpate the jaw, see if it's stable. I'm gonna check the neck, see if my trachea is midline, if I have any JVD that's presenting. I'm gonna palpate the clavicle, see if they're stable. Now I'm gonna also take breath sounds bilaterally. What are my breath sounds?
Equal.
Clear and equal, okay,
Clear,
good
yeah.
deal. Make sure I'm still getting good equal chest rise and fall with the BVM. I'm moving down to abdomen, we'll do a 4-point check on the abdomen. Is it soft and non-distended or
It's distended.
distended? Is it warm?
Yeah.
Cool. All right, moving down, we'll check for the presence of a priapism. Okay, I'm doing a 4-point check on the upper leg for decap, BTLS, and crepitus, the knee, the lower leg, the ankle, the feet, toe, look for any decap, BTLS, and crepitus on this leg. This leg doing a 4-point check for decap, BTLS, and crepitus. Now I have that arterial bleed there, be careful with it, I don't want to reopen that wound and get it bleeding in, but I'm gonna feel the knee. Do a 4-point check on lower leg for decap, BTLS, and crepitus. The ankle, the feet, the toesies. All right, while I'm down here, do I have pulses present bilaterally?
No.
Do I have them in just one leg?
Yeah.
Which leg?
Right?
That makes sense, okay. All right, can you feel me touch your toes or can you wiggle them?
No response.
Okay. Let me check just to make sure. Now I'm gonna check the upper arm, decap, BTLS, and crepitus. Right upper arm, elbow, okay. Lower arm, wrist, hand, and fingers. Also, I had this venous bleed earlier. I'm gonna go ahead and treat that now. All right, on the patient. Do a 4-point check on this left upper arm for decap, BTLS, and crepitus, the elbow, forearm, wrist, the hand, the fingers. Okay. Our pulse is present bilaterally.
Yeah.
Cool. Can you feel me touching you? Can you move your fingers for me?
No response.
Okay, well, finished my secondary exam en route. I'm gonna reassess my ABCs, reassess my vitals every 5 minutes. Consider repeating my focused exam. I've already treated the secondary injury, so that part's done. And I'm done with the station.